Welcome to today's video, which is all about CBT. CBT stands for Cognitive Behavioural Therapy, and this therapy is specifically designed for people that are behaving in ways that are unhelpful to themselves and causing them more harm than good. So for people that really want to address the way in which they're behaving in order to get a better quality of life as a result. Examples of that might include anxiety behaviours, addictions, emotional behaviours. So if you were particularly angry, or if you were particularly defensive, or if you have a particular way of being over and over again that crops up regularly. OCD is probably the most extreme example because your behaviour is repetitive, uncontrollable, and almost constant. So any behaviour that isn't working for you is great to take to CBT. I'm going to give you instead of giving you an example of how a CBT practitioner would work in a session, this time I'm going to explain a model that is used. So the way in which the practitioner would work, I'm going to make it really simple and straightforward, just to give you a quick idea about how this process operates. So it's called the ABC model. A stands for activating thought, which is another word for trigger. So, and I'm going to use myself as an example in this scenario, and I'm going to look back at when I had really severe anxiety. So an activating thought or a trigger for me would be unexpectedly having to interact socially. And the thought that I would have if that cropped up would be like, oh my gosh, they're going to judge me. What are they going to think? They're not going to like me. This is really uncomfortable. They're going to have a really bad opinion of me. Really negative self-talk going on the inside. The B part of this process is then the behaviour. So this would trigger anxiety in me. I'd feel very uncomfortable, really self-conscious, very nervous. Potentially it could lead to a panic attack. The whole experience would just be my idea of hell. The C stands for consequence, and the consequence of that would be totally plausible that I would end up having a panic attack, or my breathing would change, my heart rate would increase, I'd have horrible negative self-talk going on in my head. I would want to run away, like escape from the situation. It would just be unbearable. I just wouldn't want to be there. So if I was working with a CBT practitioner on that topic specifically, they would say, okay, looking at those activating thoughts, what would happen if you change those thoughts slightly to something slightly more rational? What are the chances that the people that you encounter are going to be really horrible to you, judge you, you know, the way that you've described? Like realistically, what's the realistic and the likely outcome of that situation? So you'd sit there and you'd kind of think, well, yeah, actually, when was the last time I bumped into someone on the street, said hi to them, and got a really shady response? Yeah, I've managed to create and blow this thing out of all proportion in my head. So they would say, okay, so if you take like a realistic response to this situation, looking at the B part of the process, where would your behaviour be different, or how could your behaviour be different? Well, okay, I suppose I could go into those situations with a pre-planned set of responses to questions and things I could say if I had to lead that situation. So, for example, if someone said, hi, how you doing? I could be like, yeah, I'm good, thanks. How's your day today? And have something prepared, or I haven't seen you for a while. What have you been up to? rather than not having anything prepared so that I fluster and feel really uncomfortable. Equally, I could have something in my head for if they ask me what I've been up to, I could kind of think, right, well, if I go out today and I met someone unexpectedly and they ask me what I've been up to, I could talk to them about my recent holiday, whatever. So that way, then if I'm caught in that activating situation, I've got a planned behaviour that's in line with realistic expectations, and the chances are I'm not going to get my anxious outcome. So therefore my consequence is going to be much more rational, much more manageable. I'd probably actually enjoy the conversation because I won't be busy panicking, and I'd come away from it feeling happy, and I'd think that was nice bumping into that person. So it's really about breaking down every part of the behavioural interaction to get to a point where you can go through the process as smoothly, rationally and enjoyably as possible. So then it's quite common for a CBT therapist to take each challenge you're working on week to week, set homework or tasks for you to practice, keep records of how often you practiced it, how successful that practice was, if it didn't work, why it didn't work, and kind of keep going over and over the strategy until you find something that fits so well for you that you're actually beginning to kind of nail your problem. Now, pros and cons of CBT. It is very immediate, it's very focused on the solution, it's very much about getting quick results and kind of finding a way of turning it all around. Con, therefore, is that no time really is spent on delving around with the kind of why you are the way you are, or what happened in your past to make this be your reality. So if you have deep-rooted, unresolved trauma, for example, CBT isn't going to be the place to explore that. There isn't the scope in the work to spend time dwelling on old things or working through mass content. It is very, very much about what's not working, how are we going to make it work, which I guess is why the NHS love it, because and this is the therapy that the NHS invariably refer people to if they need therapy, because it gives them tools that once you know how that process works and you've used it a couple of times and it is working, if something then crops up later on in life and you think, oh my gosh, I've noticed I've got this pattern, it's not working, something's got to give, without even realizing it, your brain will start to think, well, yeah, and I did that before and it worked and I turned it around, so actually I could probably apply the same logic to this situation, and therefore relapse rate is quite low comparatively to, say, some other therapies, because once you've got that skill, it can't be taken away from you. So it's great because it does really kind of get results, but it's not so great for people that feel the need to be heard, feel the need to have time spent looking at themselves as a whole, want to build that relationship with a therapist so that they can kind of look at all sorts of different aspects of their life and really explore who they are as a person. So it is a very niche type of work. It's very behaviour driven. It's very about meeting particular goals that you might have to address things that aren't working for you. So yeah, once again, as you will see in the other videos, some really great things about it, and depending on who you are, some really not so great things about it. So this is a really quick overview of CBT. I hope this has been enlightening. If you have more questions or you want to know more about it at a deeper level, please feel free to get in touch. We'd be more than happy to help. And for more information, check us out at www.whitebarntherapy.co.uk or YouTube White Barn Therapy. Thanks.